In 30 years of my career, I've never seen anything quite like this. So it's been extremely challenging, but like any challenging times, out of that comes so much positivity as well.
I think one of our biggest fears was staffing levels within the porters. Before we got the volunteers in, which were a great help to us, because we need so many on fire cover, etc., 3 on nights, we were struggling. Some of the lads went down with it, but a lot of lads stepped up.
The biggest challenge for us as medical staff and nursing staff and healthcare professions, I think, is the emotional burden of looking after patients over this time, having some difficult conversations with patients who can't have their family with them, have no visitors with them, making sure they're not feeling frightened and alone when being faced by a group of people with face masks, face shields, gowns, and that's really frightening for them.
We were just coming in, basically doing our job, doing a little bit more, relied on the staff, which was good. Everyone was going beyond the means.
I think the main challenges that the staff have faced, from the nurses to the doctors, has been not necessarily the physical challenges of working in the PPE, having the mask on and hot gowns on for hours upon end before they've been able to go out and have a drink. It's not that they found has been the most challenging. The most challenging really has been emotionally. Normally our relatives would be here, being able to sit at the bedside. For obvious reasons, we've not been able to allow that. So it's been down to the nursing staff and the doctors to be supportive to the patients, but also to have to deliver bad news over the phone it's just not the way we work.
We've been absolutely overwhelmed by people's generosity, and that generosity isn't just in the things they've given, it's the time and the thought that they've taken to help and support our staff and our patients, and we've seen the difference it makes in those small things.
Right at the beginning of all of this, I opened a card that had been delivered to the unit, and it brought tears to my eyes, as it did with lots of staff, and it was literally just a little thank you card that was obviously from a couple of children, looked about 5 or 7 years old, just writing to say thank you for all our work, and that just was overwhelming.
It has brought out a large amount of team working between specialties, even within the hospital, and between nurse groups, doctor groups, in order to support the effort to provide good care and keep everyone safe in the trust.
Probably something that stands out in my head is our Thursday evenings when we come out and clap. So our community are clapping for us, but equally in the hospitals themselves, we've been arranging Clap for Heroes. And a couple of weeks ago, our A&E department decided that they wanted to go upstairs to our intensive care unit, knowing that the colleagues couldn't come out and join in, obviously keeping a social distance. But we went up there at that time, and we stood outside the corridor and clapped for all the teams in ICU and all the patients in there too. So from me to you, a massive thank you for the virtual wrapping round of your arms that you've given us in the past few weeks. And just to say, there is still an opportunity, if you wanted to support us. It doesn't matter what it is, it can be anything that you want to. You can contact us direct now on either our email address, our website, or you can phone us directly. Thank you.